Welcome to the Division of Nephrology, Hypertension, and Kidney Transplantation at UCI.
The Division of Nephrology and Hypertension at UC Irvine School of Medicine is committed to providing exemplary care for patients with a variety of kidney diseases. All of our faculty members who are board certified in internal medicine as well as nephrology are highly skilled in the diagnosis and management of the broad range of kidney diseases. In fact, a number of our faculty members have been listed repeatedly in the best doctors in America, America's top physicians, top doctors, California best doctors, and Orange County physicians of excellence. Our fellows receive extensive experience in clinical nephrology, including one-on-one mentoring in clinical skill development during inpatient consultation and outpatient dialysis rounds. Our training program provides extensive didactic core lectures, grand rounds, seminars, and journal clubs. The division provides continuing education for community physicians and the medical and nephrology community worldwide by participating in or organizing educational conferences and publishing original papers, editorials, and review articles, and by contributing chapters to various textbooks.
We are very proud of our rigorous training program that prepares our fellows extremely well for a career in nephrology. Our inpatient dialysis services provides hemodialysis, peritoneal dialysis, and CRRT to patients with AKI or ESRD. The variety of pathology and complexity of diseases we encounter on consult service adds to the richness of our fellows' training experience. Our nephrology teaching clinic serves a diverse patient population in Southern California. The clinic is unique in that the patient panel is especially concentrated with patients with glomerulonephritis and rare kidney diseases. Our fellows receive excellent training in home dialysis modalities during their dialysis rotations. Our home program has grown significantly in the last few years, and now 20% of our ESRD panel are on home dialysis modalities, including PD and home HD. Last but not the least, we're fortunate that we have supportive and dedicated attendings who help ensure learning and success in a friendly environment.
Here at UCI Nephrology, we are proud not only to train physician scientists, but some of the best trained and clinically sound nephrologists in the Southern California area. Our fellows have unparalleled exposure to glomerular disease, with training and expertise in our core training faculty to comfortably diagnose these rare diseases in our population with a very high rate of glomerular disease presentations. Research is ongoing and is active as investigator-initiated trials and industry-sponsored trials. Complement blockade is becoming a strong expertise of a certain set of faculty here in UC Irvine. We present here the ideas of incremental dialysis, digestive health, fiber intake, cancer prevention, and the natural prevention of atherosclerotic heart disease by the control of dietary intake. Our faculty are nutritional therapy experts and increasingly provide cutting-edge guidelines and write many of the reviews and the scientific papers that help guide the science of renal nutrition, with our chief, Dr. Kamiar Kalantarzadeh, being foremost among us. UCI is an emerging go-to center for collaborations statewide and nationwide with other well-renowned academic centers. UCI is increasingly providing clinical trial opportunities that serve the Orange County and Southern California area in very diverse and cutting-edge new fields.
Here at UCI, we are the fastest growing kidney transplant program in the country. This past year, we did over 125 organ transplants, and we're looking to grow that number to much higher in the years to come. We recently got an SRTR outcome score of 5 out of 5, which is amongst the top in the country. Not only do we care about growth of volume, but we care about how well these patients do. So having strong outcomes is imperative for all transplant programs. There's nothing more exciting than following along a patient's journey going from dialysis to kidney transplant. At UCI, you'll have a ton of that experience, not only in your monthly inpatient experience, but also in your outpatient rotations on kidney transplantation and their weekly clinics. You're going to learn the exciting world of managing these patients and what a rewarding feeling it is to see them along this path. In your 2-year fellowship at UCI, you'll be assigned a faculty mentor. But aside from your own faculty mentor, the rest of us are all here for you. You'll never be alone. You'll always have a faculty member that's by your side and willing to put in the work alongside you. And that's really important. You have a young faculty that really care about your well-being and your education in these 2 years.
My name is Sam. I'm a current second-year fellow at the UC Irvine Nephrology Fellowship Program. Enjoyed my experience here at UC Irvine. I've had a great opportunity to learn through many cases. With the amount of volume that we see and the diverse pathology, I feel very confident and prepared to practice nephrology once I graduate from here.
So far, my experience at UCI as a new fellow has been very challenging. We see a lot of patients. There's a great diversity of pathology. The best thing is the camaraderie between the specialties, the research opportunities, the mentorship that's available.
Finally, our fellows and faculty take full advantage of living in Southern California with beautiful beaches, abundance of outdoor activities, and rich cultural experience. Many of our trainees join practices or academic institutions locally after graduation. We are truly blessed with this wonderful UCI nephrology family. We look forward to having you be part of this growing family.
Hi, my name is Jolene Chen. I am the Chief of Nephrology Section at Long Beach VA. Long Beach VA is an important partner with UC Irvine, and our fellows tend to spend about half of their training at the VA. The VA is a special place to work. Why is it special? It's the people. The people we work with are truly wonderful and friendly. We're a small, close-knit group, and we truly care about one another and want to help each other out whenever we can. In dialysis, we work with a team of dialysis nurses, technicians, dietitian, and social worker, and all of us work very closely together to take the best care of our veterans. Our team also want to make sure to welcome our fellows into part of our family and to make it a wonderful place for the fellowship training. Our attendings come from a variety of backgrounds. Some are world-famous researchers. Many have won accolades and teaching awards, and all of us are strong clinicians. All of us love to teach, and we take every opportunity to do so, whether it's bedside, dialysis unit, clinic, or in your lab. Whether it's clinical nephrology, academic research, or just trying to find the right career path, we're here for our fellows. What we want is to provide excellent training and education so our fellows will become successful and confident nephrologists when they graduate. Thank you.
Hi, my name is Sam Tanta, the current second-year fellow at the Long Beach VA. One of my favorite perks about working here is that we have really great attendings. It's like a close-knit family here with only 4 of them. One of my favorite things about working at the VA is that our ancillary staff and dialysis nurses are very personal. What I will take away from my training here at the Long Beach VA is learning how to take care of chronic kidney disease, outpatient care management. I think if you come to the VA, you're going to enjoy your experience. Here we have a great work-life balance.
Hello. My name is Hamid Muradi, and I'm the Site Director for the Nephrology Fellowship Program at Long Beach VA. First off, I want to commend you for choosing to pursue a career in nephrology, which in my opinion is one of the most interesting, important, and fulfilling areas of medicine. To be fair, I'm somewhat biased, but I think you and I have that in common, and that is why you're watching this video. To tell you a little bit about myself, my postgraduate training has been done at UC Irvine and Long Beach VA. Since then, I've stayed on as faculty and researcher at both institutions. So as someone who's been here at Long Beach VA since 2003, I feel like I'm in a pretty good position to tell you about all the wonderful training opportunities that Long Beach VA has afforded me and will afford you as a resident fellow or postdoctoral fellow. So Long Beach VA healthcare system is part of Vision 22 of the Veterans Health Administration in the Department of Veterans Affairs. It's located in Long Beach, California, on grounds that I consider to be beautiful, picturesque, sunny, a really wonderful place to work. The medical center provides service to our veterans population, and caring for the veterans has been one of the most fulfilling parts of my medical career. In the nephrology section, we help diagnose and manage a wide range of renal conditions, and common things such as renal complications of diabetes and hypertension, to complicated GNs and complicated post-transplant cases. We also have a large outpatient hemodialysis program where you have an opportunity to get an in-depth training about management of patients with chronic end-stage renal disease on maintenance hemodialysis. This will be done in a multidisciplinary fashion, so you will be part of a multidisciplinary team with dialysis techs and nurses, nutritionists and a social worker, as well as pharmacists. We also work closely with our interventional radiology and vascular surgery colleagues. So this sort of multidisciplinary environment is highly conducive to you getting an in-depth, detailed training and understanding of all the intricacies of outpatient and long-term hemodialysis care. We also have an acute inpatient dialysis program where you get to learn about all the different aspects and facets of inpatient dialysis care and acute dialysis management. All of these programs are run by our own faculty, so not only do you learn about the science of dialysis delivery, you'll also get a detailed understanding of the administrative aspects of running a dialysis program, which is an important area of expertise for all nephrologists and a skill set that you need to develop during your fellowship. We have an outpatient CKD clinic program as well as a post-transplant clinic. We follow veterans who've had kidney transplantation in the VA system or outside the VA system, and in our CKD clinic we diagnose, manage and follow patients with a wide range of chronic kidney diseases. We have an inpatient consult service where we see all the acute kidney injury patients and manage acute kidney injury as well as any other renal condition that needs attention of nephrologists in the hospital. So aside from the bedside rounds and bedside teaching that you get with every patient that you see, we also have a didactic teaching program with Friday morning conferences that are typically run by either faculty, pharmacists, or our fellows. We cover a wide range of topics, including the latest clinical trials, core topics in nephrology, and sometimes we even do board review questions and board review courses in our Friday morning conferences. From a research perspective, the Department of Veterans Affairs places significant importance on research and innovation, not only to advance the care of our veterans, but also to advance medicine in general. You will have an opportunity to tap into ongoing projects, of which we have many, or you can forge your own path and create your own research project in an area that you're interested in, or a novel area that no one has ever worked on but you would like to work in. In either case, we're here to work with you and support you reach your research goals. Most of our fellows go on to present their research work at national and international meetings, including the annual meetings for ASN and National Kidney Foundation. Also, many of our fellows have published their research findings in peer-reviewed journals. Overall, I think Long Beach VA is a wonderful place to train in any area of medicine, but especially in nephrology. And that has been my own personal experience. I hope you found the information in this video to be helpful and useful to you, but don't hesitate to contact us if you have any further questions. We look forward to meeting you and hopefully working with you